Hey, it's Ed. Welcome to another edition of Ed Talks. I'm with a friend of mine. She is the Chief Nurse Information Officer at MetroHealth System in Cleveland, Ohio. Jill, welcome to Ed Talks.
Thank you. Welcome, Matt. Thank you. Thank you.
I just have to say right off the bat, I recently visited, so we're recording in 2025, early 2025. I visited MetroHealth because I'm a Clevelander myself. And Jill, you were so gracious with your time as well as some of your peers and took me around. And I was just amazed. And that's why you're here as my guest. I was just amazed at all the things that you all have done. And I recall also that you actually all contributed to a book I had done on innovation, and you Metro called it scrappy innovation. And this is, this is how you really get things done. And it is amazing the amount of things that you all have done, and you do it so humbly and with so much empathy. So anyways, that's sort of the background why I wanted to have you on. So again, thanks for being here, and tell us a little bit. Now that I sort of introduced Metro, tell us a little bit about Metro Health System, and then I want to talk a little bit about you.
Sure. So MetroHealth is the county public facility in Northeast Ohio. We are over 100 years old and have been serving our community ever since the building and the hospital opened up, caring for those who need the care, and caring for those going out and caring for them within the community, regardless of their ability to pay.
Yeah. Yeah. It's so cool. And tell us about your journey there. How long have you served at Metro?
So I've been at MetroHealth now for almost 22 years. I started there in the emergency department as an emergency room nurse. I was a staff nurse for them for about 3 years, and then moved into an assistant nurse manager role down in the emergency room, and got my first kind of taste of leadership and management in a formal role. And then had the opportunity to be an inpatient nurse manager up on the cardiac step-down unit. And so took advantage of that opportunity and was in that role for about 3 years. And then decided I kind of wanted to make a change. I had a colleague of mine that I worked with in the emergency room that was the project manager for our inpatient installation of our EHR. And so she and I kind of stayed in touch throughout the years. She became an inpatient nurse manager and then became the project manager for the installation. And so was kind of picking her brain one day at a nursing gathering and said, hey, I've been looking at some different roles within the organization. I found it was a training manager role. And I said, does this report to you? And she was like, no, are you interested in something? And I was like, I don't know. I'm just kind of looking.
Yeah.
And she was like, because I'm going to have a role in informatics and I think you would do really well. And I said, well, I don't know anything outside of using our EHR. And she was like, it doesn't matter. I can teach that to you. What I can't teach is how your brain works. And she said, your emergency room experience, that anticipation of needs, that ability to see before you do an intervention, the response and what's going to happen. She's like, that's what you need to be able to think about when you're talking about implementing something into the electronic medical record. You need to be able to explain to the customer or the provider or the nurse leader, well, if we put in this best practice advisory, this is what's going to happen down the line. Is this going to solve the problem we're trying to solve? Or is there another tool that's readily available that will do it with less clicks and be less intrusive to the end user? And so I was like, okay.
Yeah.
Again, so became her manager for inpatient in the EHR. So I covered our emergency room, which I was very familiar with, the workflows, our rehab facility, our labor and delivery, mother and women's and children's, and then also the OR and all of the inpatient units. And when I joined our informatics team, there were 3 nurses on the team. It was just the 3 of us. And then we had a separate and still have a separate physician team. And I want to say at that time, there was probably 5 physicians on the physician informatics team. So we started out pretty small, probably about 3 to 4 years into doing informatics. My colleague that hired me opted to leave MetroHealth, and so her director role was available. So I applied and got that role and was the director for about 3 or 4 years, and then really started having some conversations with my my direct boss and nursing leadership to say, where do we want the nursing informatics team to go? We shifted the name to clinical informatics because we started covering more than just nursing, social work, respiratory therapy, things like that within the EHR. And then really kind of had those conversations to say, as this role is moving more into some strategy and planning, and we're getting ready for a new facility, and kind of doing more of those operational leadership type roles, we started having some discussions about changing the title and the responsibility of the job. And so it actually became Associate Chief Nursing Officer of Clinical Informatics to align with nursing leadership at the time. And then as leadership roles changed, the organization structure changed probably about a year and a half ago, now almost 2 years. We opted to make the change to the Chief Nursing Informatics Officer. So it's kind of been organic for me the whole way through, even from a title standpoint.
Yeah, well, it makes total sense. And like you were sharing, the skills that your former boss identified in you as a nurse in the, work in the emergency room are the skills that really are needed. And sometimes the IT stuff, that's the easy stuff, right? And you're marrying the IT with all your deep knowledge of the processes, the clinician, point of view, and marrying it all together. So it makes total sense. What are one or two super fun things that you've been able to do as a CNIO or in some of the previous roles, working with tech that have really made a difference to the patients and clinicians?
Um, I think starting off, we opened a new inpatient tower in 2022. And so obviously that planning started 5 to 10 years prior to the building ever opening, and just being part of that process and really starting to think about what is it that we wanted to put into the patient's rooms for the patients to interact with, for them to feel more comfortable in the hospital environment. And then also, how do we connect them better with the caregivers that are working within the hospital as well? And so, started to have some conversations about the technology we wanted to put into the new hospital tower. And so, I think some of the really innovative things that we started to look at was creating a patient electronic whiteboard. So we have the patient TV, it is separate, two monitors in the rooms. We did the patient electronic whiteboard so that the information within the EHR can display for the patient, and display for folks caring for the patients within the room. The patient can tell the nurse a little bit about themselves. And so that can display for anybody coming into the room, tomorrow's my birthday, or, I miss my dog at home. And so, that way it makes it a little stronger connection with the patient and the nurses. It also has an interface with our RTLS safety badges. So when anybody walks in the room, it will display their picture and then their first name and their job role, so that anybody coming in and out of the room, the patient and their family, knows who they are and why kind of they're there. And then also that allows them to ask the right person the right question. So you are asking the nurse and the clinician the clinical questions, and not, reaching out to the environmental services team or a dietitian or someone that may walk in the room and say, hey, can you get me my pain meds? It makes it a little bit easier for the patients to know who's in their room. Also a safety issue, that someone's walking in and you know who they are. We also have digital door signs outside the doors, again, pulling information from the EHR. That allows anybody walking into the room to know a little bit about what's going on in the room. So falls risk, any type of infection control isolation is displayed out there. Even if we've had to make a patient nothing by mouth or NPO, for a procedure or surgery, that can display so that, dietary knows not to deliver that tray if by chance something should come up. So there's a lot of technology we put into that hospital to help the patient and the caregivers for the patient with more information, and right there, without having to dig into the charts.
And that's what I was referring to in the beginning of our chat, is how progressive. And again, you guys are the ones who came up when you helped me write this book on innovation, this sort of scrappy concept. And you're actually, that's why I'm so impressed. You're actually doing a lot of the things that many others aspire to and are getting to, but you're able to do them. And we talked a little bit about how you do that, and with the scrappy innovation and doing smaller projects first and then expanding from there. It's just amazing. And I know we could go on and on, but you're doing so much more. I know you're doing some leading things in remote patient monitoring and also in virtual nursing and things like that. It's just really amazing. And I think Cleveland in the Northeast Ohio region I think they're so blessed with having a MetroHealth system there, providing the care that you do. And it's because of great leadership like you. And I know you work with a great CMIO, and you've got a great CIO and Dave Pfizer and Michael Sue up there working. And there's a bunch of others I shouldn't name drop because then I'm going to miss someone and then bad. But it's your group, it's your team that's doing such an amazing job. So thanks for sharing and giving us a glimpse into some of that and being a guest on EdTalks.
Sure. I'm happy. I'm so excited you asked. So thank you so much for having me.